Hippocratic bench. Long ago, breaking a bone was terrifying. There was no painkillers, no x-rays, just the hope that the bone would somehow set correctly. Enter the Hippocratic bench, a clever but intimidating device from roughly 2,400 years ago. This wooden platform had ropes and pulleys attached to it. A patient would lie down, and their arms or legs would be tied to ropes. Slowly, a doctor or assistant would tighten the ropes, stretching the limb to align the bones or pop a dislocated joint back into place. It was a rough kind of traction, sometimes painful, but it worked better than simply pressing or guessing. This device shows how early medicine relied on mechanical ingenuity. Even though it looks terrifying today, it was an essential step toward modern orthopedic care. Patients might have endured the ropes, but at least they had a chance for their broken bones to heal correctly. Phlegm. For centuries, doctors believed that most illnesses were caused by too much blood, or an imbalance of bodily fluids. So, they used instruments to remove blood. The phlegm, a small handheld blade, was designed to cut a vein and let blood flow out. It seems extreme, but it was routine. By the 1700s, more complex tools appeared. The scarificator had a dozen or more tiny blades that would spring out simultaneously, cutting multiple places at once. People used it to treat fevers, headaches, and countless other conditions. They genuinely believed this could rebalance the body's humors. While dangerous and often ineffective, these bleeding tools highlight how early medicine combined observation, trial, and superstition. They were a mix of ingenuity and misunderstanding, shaping the evolution of surgical practices. Metal leech. Live leeches were once a popular medical tool, but some found them messy or unpleasant. Enter the artificial leech, a mechanical device that mimicked a leech's work. These contraptions used a blade to cut the skin and a small vacuum or suction device to remove blood. They were used on delicate areas where a live leech might be risky, such as near the eyes or temples. It's fascinating how human creativity replaced a living creature with a machine, showing early mechanical innovation in medicine. Even if it seems gross now, this device reflects the relentless human desire to solve problems with the tools at hand. Smoke enema. Here's one that's almost unbelievable today. In the late 1700s and early 1800s, tobacco smoke enemas were used to treat various ailments, and even to revive drowning victims. Doctors believed that blowing tobacco smoke into the rectum could stimulate the body, warm it, and bring life back to patients. Special kits were manufactured, complete with bellows and tubes. Some were even stationed along rivers for emergency use. It seems absurd now, but at the time it was cutting-edge medicine. It's a striking reminder that medical understanding evolves. What was once heroic or scientific can later appear completely bizarre. Trepanning, or trephination, is one of the oldest known surgical procedures. Surgeons used tools like the trepan or trephine to bore holes into the skull. The goal? To relieve pressure, treat injuries, or according to ancient beliefs, release evil spirits causing illness. No anesthesia, no antiseptics. Patients survived largely due to careful observation and slow technique. Archaeologists have found skulls with perfectly healed holes, showing that some patients lived. This procedure is terrifying to imagine, but highlights human ingenuity in early surgery. Ivory enema syringe. Before modern syringes, doctors used metal or ivory enema syringes. They were simple but risky, designed to flush out the bowels. Physicians believed that cleansing the body could cure a variety of illnesses. These syringes weren't disposable, and sterilization was non-existent. Reuse often spread infection rather than healing it. Yet, these devices laid the groundwork for the hygienic, safe syringes we rely on today. Stone tool. Bladder stones were a deadly problem in ancient and medieval times. Early surgeons developed instruments to remove or crush stones without cutting open the body. Long metal tubes could be inserted through natural openings. Tiny pincers or crushing tools would break stones into small pieces, allowing them to pass naturally. This method is a precursor to modern lithotripsy. Risky, painful, and often disgusting, it saved many from the agony of open surgery. The écraseur. The écraseur was a device with a wire loop, designed to cut tissue like tumors or hemorrhoids slowly. By tightening the loop, blood flow was stopped before removal, reducing bleeding. While effective, the process was painful and dangerous. Surgeons used it for operations where no safer method existed. It shows the balance of necessity and innovation in historical medicine, often brutal, but sometimes life-saving. Mouth guillotine. Dental and throat surgeries were notoriously crude. The tonsil guillotine, for example, was a sharp instrument designed to remove tonsils quickly. Without anesthesia or sterilization, procedures were excruciating. Patients endured blood, pain, and risk of infection. Despite its brutality, This tool laid the foundation for modern dentistry and ENT, ear, nose, throat, surgery. Bragg-Paul pulsator. Not all old devices were cruel. The Bragg-Paul pulsator, an early mechanical ventilator from the 1930s, helped patients who could not breathe due to paralysis or disease. By mechanically pumping air in and out, it gave patients a chance at survival. This invention marked a turning point, leading to the famous iron lungs that saved countless lives during polio epidemics. Heat chamber. Doctors in the 1800s also experimented with heat therapy. Patients were placed in hot air chambers, leaving only their heads exposed. It was believed that intense heat could cure pain, arthritis, or chronic illness. Today it seems strange, but it reflects the era's fascination with physical interventions to balance the body. These treatments were dangerous, yet they illustrate early experimentation with environmental therapy. Tooth key. Removing teeth was a terrifying experience. The tooth key, a primitive extraction tool, worked like a lever, often crushing surrounding tissue. Without anesthesia, patients endured extreme pain. Despite the danger, these tools paved the way for modern dental extraction devices, showing how necessity drives innovation even in the face of discomfort and risk. In conclusion, these 12 devices, from benches to ventilators, from smoke enemas to skull drills, tell the story of human creativity, curiosity, and sometimes desperation. Some inventions were brilliant and life-saving. Others were misguided or cruel. Looking back, we can appreciate how far medicine has come. Safer surgeries, anesthesia, sterilization, hygiene, and scientific understanding. But we also gain perspective on the ingenuity of humans who, without modern knowledge, risked life and limb to fight disease. History isn't just dates and facts. It's a story of trial, error, courage, and sometimes bizarre ideas. These medical inventions entertain, educate, and remind us that curiosity and necessity often drive progress, even in the strangest ways.